Thank you so much. I am so honored, Aaron. Thank you for that kind introduction. Thank you, Daniel. Thank you to the entirety of the team there. Really appreciate the time I have with you today. At the outset, I want to let you know that I've been having some technical difficulties today, so forgive me, please, if I cut in and out. I promise that I will jump back on if my video goes out, but I would ask that if you wouldn't mind, until we get to the Q&A discussion, if you can turn your video off. That may help with some of my bandwidth issues here. Like Aaron mentioned, I've had to be off site. I'm currently in a hotel, but I didn't want to miss this opportunity to be with you. So again, please forgive me if this cuts out. I'm really looking forward to a meaningful discussion with you. All right, let's see if we can get this going to the next slide. So I have a few disclosures to share with you today. And the disclosures, they aren't financial disclosures that are relevant to this talk, but they're disclosures that really inform what I do. And really, hopefully some of this speaks to you today as you consider your careers, your career trajectory and what you've accomplished so far. But I'm a man of faith, a husband and a father, a physician. I have an active clinical practice where I see patients as a general gastroenterologist, but I'm also a physician researcher. I've done research, clinical research predominantly, but I'll speak to some of my path more in a little bit. I'm also a community advocate and very outspoken in my community and trying to translate the work that I do, whether it's in research or work that I do in the clinic, to really being applicable to people we serve in our communities. I want to walk you through my path to where I am today and what I'm doing and why I think it's relevant to you as you consider your career path. But, you know, I'm originally from Baltimore, Maryland, the East Coast. And I left Baltimore, Maryland after high school and went to a historically black college called Morehouse. That's in Atlanta. It's an all-male college in Atlanta, Georgia. And while I was at Morehouse, my interest was largely around the sciences. And particularly I majored in biology. But that, you know, at the time I was envisioning a career in medicine. And so while I was there, though, I also did some basic science research. I was working at Morehouse School of Medicine, and we were trying to develop novel markers to be able to have quick, easy, and cheap testing for infectious disease that cause morbidity and mortality in third world countries. So I was working in a basic science lab. But while in that basic science lab, I quickly realized that I liked that work, but I didn't love it. And I didn't foresee myself pursuing that as a career passion. And so really that helped to cement for me an idea that was sparked many years before for a career in medicine. And so after I left Morehouse, I went to Howard College of Medicine, so another historically black university where I did my medical school. Now I'll say also, while I was at Morehouse, one of the things that's was really important to my career and my aspiration was traveling outside of where I lived. I was blessed to have the opportunity while I was at Morehouse to do some traveling. I participated in a program where I went to, for example, to Dublin, Ireland, and was able to interact with scholars from all over the world, as well as some world leaders at the time. And similarly, when I was at Howard University College of Medicine, I also was able to travel to Ghana, where I was able to see medicine in a different way, to see how herbal medicine played a role in the care of patients. And that was after my first year at Howard University College of Medicine. But I also realized while I was at Howard that I wanted a different experience. I had had experience at two historically black universities or colleges, but I noted that I wanted to actually be in a different environment where I could be at a predominantly white institution, but more so that I could have exposure to a large academic hospital and be able to see a diverse cadre of patients that were very complex. And so I went to Duke University Medical Center, where I pursued a residency in internal medicine. And then I went to Washington University in St. Louis, where I pursued my gastroenterology fellowship. And while there, I realized that I didn't necessarily want to go straight into GI academic practice. I actually really recognized that there were some deficiencies that I had in my knowledge base and in my practice that I wanted to fill. And so I took a pivot, and I'll come to this as we get into our discussion. It's okay to pivot. So after I finished my fellowship, where I was doing gastroenterology fellowship and actually had built a program in St. Louis where I was connecting patients from churches and connecting them to primary care and ultimately to get specialty care such as colorectal cancer screening, I realized that I did not have the skills to translate this program into something that was really focused on a specific community, African Americans, in a specific city in St. Louis, to something that could be broader and translate into policy change. And so I pursued a health policy fellowship, an MPH or Master's of Public Health degree at Harvard. And so I did that for 1 year following my gastroenterology fellowship. Before then, I was recruited to Ohio State. So I say all of that, all of this was, chasing after a dream, chasing after what I felt most passionate about, chasing after what I felt I was called to do and how I was called to impact people and their lives. And so that leads me to something that I heard from a colleague and fellow Morehouse brother at a Black Male Summit in 2019, where I was co-presenting and Sean King was a speaker. And he said something that really he said in a way that I've been trying to explain to my mentees, usually taking minutes or paragraphs to say. And he said it so simply in one sentence. He said, do the thing that makes you come alive to impact the issue that breaks your heart. Do the thing that makes you come alive to impact the issue that breaks your heart. And so as I think about my career trajectory and you think about yours, do the thing that makes you come alive to impact the issues that break your heart. And so I want to focus on a few things. I'm going to give you some pearls that I have acquired throughout my journey thus far, both in training, but also being a faculty member, someone who speaks at different institutions across the nation, someone who has traveled to other places and interacted with leaders across the world. I want to share some pearls that I've gained. And then I also want to talk about some things I think are really helpful for you as it pertains to mentorship and sponsorship. So just like I said, do the thing that makes you come alive to impact the issue that breaks your heart. Focus your time and talent on work that is personally meaningful to you. Find that connection between what you're doing in chemistry or physics or biology, or ultimately a career in medicine or industry or pharmaceutical work, whatever it may be. Find that thing within that is personally meaningful to you and chase after that with all that you have. Not only is that a way to secure happiness in what you do, but also success as you think about your next steps. What's so important in what you're doing right now, regardless of what level you are at, is that you be a storyteller. In enabling that work that you are very passionate about and you're investing time, talent, and energy in, be proficient at telling others what that means. So whether you're doing something in a basic research science lab, whether you're doing computer science work, whether you're doing chemistry, whether you're working with zebrafish, tell someone, be able to tell someone from no matter what background they come from, what it means to them that you're doing this work. How is it meaningful to you? And what will it mean for our future? Be a storyteller. So I think about, I'll put in more context. So I think about those who do Alzheimer's research and maybe work on a specific molecule that is hopefully going to change the trajectory of patients with Alzheimer's disease. Well, how do you translate that to your grandfather who maybe had not had a college degree, but maybe is having difficulty with a family member who has Alzheimer's disease? How do you translate that work that you're doing at the bench or in science to someone who ultimately wants to fund your work? Or a community advocate who is trying to raise awareness about Alzheimer's disease and treatment and the importance of research? Be a storyteller and tell a story so compelling that people want to help you write that story. And that's where teamwork comes in. Invest in relationship and trust. One of the things I've learned is that change happens at the speed of trust. So whether you're a postdoc, whether you're a faculty member, whether you're a student, invest in the relationships, whether they be mentors, whether they be colleagues, invest in those relationships, because that's what will help you traverse the difficult times, but also that's what will help you to change the world. And what does that mean? What does investing in relationship and trust mean? It means be curious. Have empathic curiosity, meaning, whether it be people on your team, fellow students, colleagues, staff, faculty, ask about them, even outside of the confines of the projects you are working on together. Find out about where they live, where they're from, what's important to them, who they are as people, because then they can help you champion. You want to get to know the people that you are going to be leading. You want to get to know the people that you're working alongside. And lean into teamwork, because it helps you weather adversity. Challenges will come, but I strongly believe that setbacks are set ups for comebacks. I think about many challenging times that I've experienced, and really it was those times when I didn't lean into myself as an individual, but I leaned into others, whether it be colleagues, family, or friends, to help weather adversity. So whether it's you writing a paper, you writing a grant, you going up for promotion and tenure, adversity and challenging times will come, but you'll need those people. Now think, sometimes you think about, well, how can I lean into a team that I don't even know that well? We don't go way back like that. But I reminisce on, if you've ever seen, I'm actually where I'm at right now, I'm on the West Coast. And I think about redwood trees. I don't know if any of you have ever seen in person or from a distance or online or on a PBS show, redwood trees. But redwood trees are just so majestic. They are so tall and large. I mean, if you are in their presence, it is almost an outer body experience, if you will. And what's interesting about these such tall trees is that they have a very shallow root system. So these tall trees, that take up such expansive space, weather storms, weather wind, weather floods, but they have such a shallow root system. How do they sustain themselves and weather the storms? Is through their interconnectedness. They become so strong because they have a web. Even though their roots are very shallow, they go across and they connect to other trees. And that's what gives them strength. So even as you think about your teams, as you think about your work, it's not necessarily that your teammates, you go way back, that your friends or family, but that you have this interconnectedness with what you do that makes you strong. So lean in to teamwork. For me, what has allowed me to do what I enjoy doing, in doing the thing that makes me come alive to impact the issue that breaks my heart, is centering at the margins. When I say center at the margins, it's really trying to elevate the voice of those who are made vulnerable by systemic inequity. Particularly, I think about underserved populations. I think about racial and ethnic minorities. I think about sexual orientation and gender minorities as well, and how we can move closer towards health equity, whether it be through work that we do in the science, the most basic of science in the laboratory, whether we're doing it translational research, or whether we're doing it through clinical care and community engagement. So I want to speak to some specific things that I participate in, and I hope that you can see yourself and some of the work that you do translating to things like this as you think about your career trajectory. Certainly, as we reflect on the impact of COVID-19 on all elements of our life, it has impacted healthcare for sure. And one of the ways is telehealth. So as you may know, telehealth is how you can connect to a physician or healthcare provider through your phone, through the computer, and see them, whereas you may have otherwise just been able to see them in person. But certainly as COVID-19 prevented in-person encounters, we really moved to where there was a revolution around telehealth. And our health system really moved from having hardly any telehealth visits to really majority telehealth visits amidst COVID-19 pandemic. But one of the things that happened is that people were getting left behind. Our seniors, those in low income areas, those racial and ethnic minorities, those in rural populations, because many did not have access to Wi-Fi or broadband. For those who did, they didn't necessarily know how to access telehealth, meaning they didn't have the telehealth literacy skills, or they didn't have the devices to be able to leverage it. So how are we overcoming that? We're expanding broadband through grants that we've written. We've been able to expand broadband for people and get access to Wi-Fi. We've been able to deliver devices to patients in neighborhoods that don't have access to devices or are low income and couldn't afford it. We're working with community health workers to ensure that people understand telehealth literacy and understand how to interact with their devices to be able to access their patients. But also, how can we make accommodations for those who are disabled or living with disabilities? How do we train our next generation of physicians, nurse practitioners, nurses, scientists, how to have digital empathy or website manner when you can't interact with a patient in person? But also, it's so important that we center ourselves around community engagement. Many of us are familiar with community outreach, right? That's where someone sets up a health fair, people come, they might give a talk, they might do some blood pressure screening, might give out some giveaways, but that's very transactional and short term and honestly short-sighted. How can we really sustain relationships in changing the health of our communities? That's community engagement. And I'll give you an example. One of the ways we've been centering the voices of our community is really listening to them. We at Ohio State, we acquired a building that was a former Martin Luther King Jr. library in Columbus, Ohio, one of the first Martin Luther King Jr. libraries in the nation, frankly. And that building became vacant. They built another one nearby. And so OSU acquired this building. But what I appreciated is that we didn't just say, we're going to make this an emergency department. We're going to make this a new surgical center. We're going to make this a new clinic space. But we went to the community first and said, how do you want this building used? And the community said, well, Doc, we recognize that, we live in an area that's food insecure. This is an area that's highest for chronic diseases, chronic kidney disease, diabetes, heart disease. Doc, we don't have access to a restaurant in this area. You may know, Doc, that we come into that OSU East Hospital to eat in the cafeteria because there's nothing nearby. And so we use that input and we're turning this space into a healthy community center where we can have a retail cafe, a demonstration kitchen where we teach people how to cook, how to prepare food to optimize nutritional value, even on a budget. And this is a family-friendly area. We'll also have a fresh food market where people can access fresh fruits and vegetables for free, and have conference space where people can co-work and mingle together as a community. This is centering community voices. But also, one of the things I heard amidst COVID-19 is patients and community members would say, Doc, this was in May. So after the first surge we had in Ohio, and people would say, Doc, I am so excited that, we're starting to reopen businesses here. I'm excited because it means that I have income to keep the lights on, to keep my family afloat, to eat at the table. But Doc, I'm having difficulty entering the workforce, re-entering the workforce actually safely. I don't have the masks that we need. I can't find the hand sanitizer. Frankly, it's hard for me to afford it. So Doc, I'm an essential worker. I'm a bus driver. I'm a taxi driver. I'm a grocery store worker. What can we do? So myself and a couple of colleagues made a proposal, and we identified through some data analytics 5 key zip codes where not only was the highest burden of COVID-19, but also highest burden of social vulnerability, whether it be because of neighborhood context, environment, or physical context. Also, highest areas of burden of chronic disease. And we identified these areas, but we also partnered with the community. We partnered to get hand sanitizer. We partnered to get dental hygiene items. We partnered to get masks. And in total, we gave out 40,000 masks, 18,000 hand sanitizers, 12,000 dental hygiene items to neighbors and community members and essential workers in these 5 target zip codes. And this was all through partnership, through academic, community, and government partnership. We had our Columbus Public Health there, our Franklin County Public Health. We had our congresswoman there, our mayor there. They were all participating. And this is through what community engagement is, really amplifying the voices of those made vulnerable by systemic inequity. But also know that wherever you are, Whether you're a student, a postdoc, staff, faculty, your voice matters. Each and every day you generate stories, whether they be at the bench with laboratory work, whether they're in your space of teaching, whether it's out in the community, you interacting with family, your friends, whether it's through all of these Zoom calls we're doing right now, you generate stories. And these stories you can translate into policy change. And so I had the privilege, I was seeing patients who were coming in, ultimately being hospitalized because they were going to work with COVID. They knew they had COVID, but they felt they had to still go to work because they couldn't afford it otherwise. They needed that paycheck to keep the lights on, to sustain their families. And so I worked with our city council to enact legislation where we put over $1 million to provide assistance to those who needed time to recover safely at home. And so your voice matters no matter where you are. Take your stories to your city council people, take your stories to your congresswomen, your senators. Your voice matters and can translate into change. The other thing, again, is community engagement. I have had the opportunity to partner with the African American Male Wellness Agency, which is in Columbus. As a matter of fact, now they're in 16 different markets, from as far west as Seattle to far east, northeast to as DC, and southeast is Atlanta. But when I first started working with them, I interacted with Mr. John Gregory, who's the founder on the right. Again, this organization has been around since 2004. I first started partnering with them in 2014. And he said, Dr. Gray, I'm excited that you're in Columbus now. I know that you're a gastroenterologist. It's cool you're passionate about colorectal cancer. But let me tell you, Doc, my community is more concerned about heart disease. We're dying from chronic kidney disease. We're dying from diabetes. What can you do for me there? And so that's a moment. As you think about what you're interested in, what you're invested in, what you're spending your careers doing, whether it's studying or now on faculty, as you think about what you're doing, you're going to have inflection points where people come to you with sometimes seemingly competing priorities to your own. How do you move forward? What do you do? And so we took this as an opportunity to engage with our community and really invest in community engagement, which has to do with reciprocity or a mutually beneficial relationship. So while Mr. Gregory and the African American Male Wellness Agency's priority was around heart disease and diabetes and chronic kidney disease, and mine was around cancer prevention, we found an intersection there. And so I partnered with a brilliant medical student, and we did a systematic review to better understand what community-based research had been done, particularly amongst African Americans, to engage them and improve their cardiovascular health, or trying to get to ideal cardiovascular health. Well, it turns out that the American Heart Association had a framework called Life Simple 7, or 7 factors that contribute to ideal cardiovascular health. But these also contribute towards something I'm interested in decreasing cancer incidence. So we did this systematic review, and we found out basically hardly anything had been done, and hardly anything had been done well to improve the ideal cardiovascular health of African Americans. And so we turned this into a grant opportunity, and partnering with that community partner, the African American Male Wellness Agency, to follow men, particularly 100 men who had less than 4 of these ideal cardiovascular health metrics, to partner them with health coaches and community health workers to ultimately connect them with primary care, to facilitate a 24-week intervention of exercise in which they were working with personal trainers, but also education, talking about anything within holistic health, from financial wellness to mental health to physical health. But also, as many of you know, there is a lack of diversity in clinical trials. So we wanted to connect these men to information so they could be champions about increasing diversity in clinical trials. So not only were we focused on their numbers and improving their ideal cardiovascular health, and yes, decreasing their incidence of cancer as well, but how do we think more broadly about changing the narrative around clinical research? But this came through community engagement and centering community voices. And certainly none of this would be possible, like I mentioned before, without a team. And I have the pleasure of working with a large team. Aaron had mentioned some of the roles I serve and the people I get to work with, whether it's our Health Equity Steering Committee, our health system, our anti-racism action plan across our health system and health sciences colleges, our study work, what we do around voting, what I do with pipeline programs such as Heads Up, or external collaborators across the nation. It takes a team to get the work done. So it's so important that you have a team on your side. And speaking of which, one of the things that you will need as you build your team is like what I like to call a personal board of directors, having mentors and sponsors to help you along the way. And so as you think about mentors, it's so important that you have mentors. Those are people who provide advice, feedback, and coaching, which is sometimes different than a sponsor. A sponsor is someone who's in a position of authority to use their influence to help you advance. This might be someone who is a senior professor, or someone who is in charge of your college or your program, who has connections nationally, who says, you know what, Aaron, I think this opportunity for this national committee would be a great opportunity for you. May I nominate you for this? Or they may say, Daniel, you know what? I've noticed the work that you've been doing. I think you would be great for this award. May I write a letter for you to nominate you for this award? That's what sponsors do. So mentors a lot of times are the coaches, and they help to build your plan and help you to execute your plan and provide, guidance on how to avoid potholes on your journey, or, things to expect on the journey. But sponsors can sometimes open these critical doors, and perhaps they're not the ones that you talk to regularly like your mentors, but they're the ones that always have you in mind and are ready to open opportunities for you. But both are based on a foundation of mutual respect, trust, and understanding. So as you think about how you find mentors, or kind of steps to guide you to finding prosperous mentorship and sponsorship relationships, think about who is your primary career mentor. So who are those one or a couple of people on your personal board of directors who clearly understand and can articulate your vision, your mission, your career aspirations, who understands the steps that you would like to take to get there, whether it's kind of postdoctoral work, whether it's internship work, whether it's ultimately being on faculty, whether you want to be in industry, not only understands kind of the landscape of what you want to do, but then can help coach you through that. Who are the technical mentors? So perhaps you study a specific thing and you need someone to help you with the technical aspects of that work to be successful. Maybe it's someone who is, as you're thinking about writing a grant, who is proficient and successful at writing grants, who can help you execute your specific aims page for that grant, who can help you execute, that objectives and paint a picture so perfectly for maybe you're wanting to submit to the National Science Foundation. Who's been there and done that, who can be a technical mentor for you? But what about the sponsors? What about those in high leadership positions who can help you open doors? Think about how you identify those people. And are there those in your network who are master connectors? Maybe they aren't your mentor, maybe they aren't your sponsor, but they are so well connected that they can connect you with someone who can be your sponsor, or someone who can be your mentor, or knows how to connect the dots for you.
There we go.
I'm back. Did I cut out quite a bit? I'm gonna share the screen again.
Nope, you just cut out for about I think it was less than a minute.
Okay, sorry about that.
That's okay.
Can you see the screen now?
Yes. Thank you.
So clarify what you need. Think about specifically what you're asking this mentor to do. Also, do you envision this being a short-term or a long-term relationship? Is this a mentorship throughout your postdoc? Is this a mentorship throughout your faculty position to help get to the next advanced level? But think about specifically what you need when you're requesting to have a mentor, but also choose wisely. Talk to people who have had this mentor before and see what their insight is into this mentor. There used to be a saying, everything that glitters ain't gold. And that basically means that everyone that looks like they can be a mentor, everyone that looks like they've accomplished everything or has it quite together may not be the best mentor for you. So talk to people who have had this mentoring, choose wisely. But also think about how you can underpromise and yet over-deliver. So how might this manifest? So let's say you're working with your mentor and there's a research project you want to do. You're thinking about some new thing that you're going to do in the lab, or something you're developing, or a proposal you're putting together, and you're working with this mentor. Well, maybe there's a specific deadline, but you instead, you kind of underpromise and overdeliver, meaning when the abstract is due, you're a couple of weeks ahead of time. You're over delivering on that. That's one example of how you can over deliver. So trying to exceed the expectation. They may be traveling across the nation. So yes, mind your mentor's time. Think about how you can exceed their expectations and then mind their time, but beware of pitfalls. And I'm going to talk about some pitfalls as well. But lastly, be energized and engaged. No one wants a mentee that is kind of sour or not enthusiastic about what they're doing. Think about ways that you can always stay energized and engage with your mentor. Always, even if you're having a rough day, it's okay to sometimes be transparent about that with your mentor, but be someone who is positive, who looks at setbacks as setups for comebacks. Again, mentors want to work with energized and engaged mentees. So beware of mentorship malpractice. Unfortunately, there are mentors out there who may use your ideas or projects or grants for self-promotion. Beware of mentors like that, or self-gain. Beware of mentors who assign you to kind of non-academic chores that really don't align with the work that you're doing or your personal mission. Mentors who discourage collaboration. What does that mean? So maybe you have a mentor who you're working with and you have this idea that's cross-disciplinary or translates across different labs or different aspects of your work, and to even trying to reach someone who's maybe across campus and doing something, or even someone outside of your institution. But perhaps you run across a mentor who says, nope, don't share this with them, or I don't think that would be a great idea. Sometimes it's okay to challenge that, because we work in a very team science is the way to go these days. So think about, as you choose your mentors, beware of mentors who discourage collaboration, but also beware of mentors who lack the bandwidth and or interest. Again, many of your mentors are busy. They're balancing work, they're balancing grants, they're balancing projects, they're balancing teaching. And sometimes, albeit they may have the expertise for you, they may not have the bandwidth to invest the time that you need at that time in your life. And so be fully transparent with what you are asking as far as time commitments, so that your mentor, potential mentor, can be fully transparent about the bandwidth and interest they have to help you. but also beware of those mentors who fail to advocate. Maybe it's you're trying to advance. Maybe it's you're going to the next step. Maybe you're applying for a promotion. Maybe you are applying for an award. Maybe you are trying to get to the next step of your career. Your mentor has to be the one rooting for you, not only rooting for you, but helping to open doors for you to get to the next step. So beware of mentors who fail to advocate for you. I want to take you a step back in my career. This picture was taken, so as you can tell, this was definitely not an iPhone 11 or anything like that. This was taken on a camera when I was the day, what's called match day, when I matched while in med school. So this was graduating from medical school and preparing to go to residency. And I believe it was probably my mother who took this picture. And it looks like I was the first one to jump up after opening that letter on match day. When I found out I got my #1 choice to go to Duke for residency. You know, that moment, as I think about it, was such a pivotal moment, but that moment happened because of so many smaller or briefer moments before. It happened because of mentors and sponsors. It happened because I was clear on my mission, vision, and objectives. It happened because I was doing the thing that made me come alive to impact the issues that break my heart. And so, as you think about moments in your life, moments now, moments you've been through, moments you hope to experience, make sure you have a team on your side. Make sure you're a storyteller. Make sure you have mentors and sponsors. Make sure you're investing your time and talent into what you're most passionate about, because again, that's how you'll be happy, but also how you'll be successful. You know, I'm so excited to be here with you today. I'm glad that we have time to engage in question and answer. Thank you for forgiving me for my technical difficulties today. But I thank you, from my family to yours. I thank you for this opportunity. I'm interested in having the time to engage with you in Q&A. And I'll stop sharing my screen.
Dr. Gray, let me first be the first to say what an inspirational talk, so actionable, and I think hopefully we'll have lots of questions and thoughts as well, but thank you.
Thank you. And if I cut out, Aaron, what I'll do this time, since we're on Q&A, is I'll pull it up on my phone, which may have a better signal. So hopefully I won't cut out again. But
that sounds great. If anyone wants to turn off or turn on their video and ask questions, they can do that verbally, or you can also type them in the chat. Either one works. So Dr. Gray, I'm not sure if you saw, but one of our students just said that they will not forget the quotes that you shared and how meaningful they were.
Oh, thank you. Thank you so much. You know, one thing that I've made a practice of is storing different quotes that I have found meaningful to me to share. So, you know, for a student who mentioned that, you know, consider adding quotes to note cards and memorizing them because you never know when you'll be able to impart a word to someone that you may be mentoring, or someone who can use those words for encouragement, or just to kind of recalibrate with what they're doing. So I do that quite commonly.
That's great. Someone else just shared that your talk has been so relevant to what they're facing right now, and just thank you. And also someone else said that they've been super stuck about figuring out the future, and this just was a perfect talk right now. So
thank you.
So I guess you talked a lot about finding that mentor. Anything specific that you did on your journey to kind of find that person to champion you?
Yeah, I think, you know, first I made sure I was in spaces where I could see those who were doing what I aspire to do. What does that mean? Well, whether it's attending a conference, for example, where I would get exposure to people who are doing work that I aspire to do. You know, back then it was more in person than virtual. So now we have the benefit of a lot of virtual conferences. Or whether it's through a community of friends or colleagues, connecting to those people. And, in some cases, they were cold calls or cold emails, meaning I would contact the person having no connection and just saying, hey, I heard your talk. I love what you do. I'm interested in following in similar footsteps. Would you mind sharing some time just so we can have an initial discussion about potential mentorship or potential sponsorship opportunities? And that's how a lot of it evolved over time was through methods like that, just seeing those who, and then like I said, trying to connect with those who may have been mentees from that mentor and trying to see what their experience was before I reached out if possible. So
that's great. Another question was, you mentioned some of the donations to vulnerable community members. How do you see going about making these efforts sustainable throughout time and over time?
yeah, so that's what's so awesome about community engagement is because it's shared ownership. So as opposed to community outreach, where it's transactional. So either, give an example, our health system might sponsor a health fair, or in a different situation, maybe the community organization sponsors an event and we come, we show up, we interact, but then we're gone, right? Or we have this research project we want to do. And so we tap into the community to do some surveys, or maybe we're in kind of biomedical space, and so we're trying to collect samples for something. But once the research is done and the paper is written, we're gone, right? Helicopter research, you fly in and then fly out. Well, community engagement is sustained. So the way you sustain it is through that shared ownership. And so from the very start, with a lot of the work that we're doing now, it's shared ownership to ensure sustainability. So albeit we may utilize grant funds to get it started, at the outset, we're saying this is going to be something that once this grant runs out, we both have to own. There has to be shared ownership, not only in the work, but in the financial sustainability of it. And so that's what's beautiful about community engagement, is that really it fosters that sustainability from the outset. That's part of the goal.
That's great. Another question from a student: how would you advise students who feel like they're currently being blocked from a pathway that they want to follow?
Yeah, that's great question. And you see it, I certainly see it sometimes, whether it's in medicine or other kind of science fields where, and maybe it's that they have a mentor and they're in a lab or, sponsored by someone who has a very specific focus that doesn't really align with what the student wants to do ultimately. So maybe it's a project that helps they get the foot in the door, but the student is thinking, this isn't what I want to do with the rest of my life. And so I think that it's in such situations, particularly as you're just starting to get your foot in the door and just getting your feet wet, maybe with research or with projects, it's okay to, continue to try to complete one project, but keep your vision on that larger, broader vision. And if you feel like there are people or practices that are in the way of you achieving what you want to do, it's also okay to look elsewhere. And I think about that for faculty and staff too. If you feel like you are undervalued, if you feel like you're not able to do the work that you want to do, it's okay to look elsewhere. So it's okay to look outside of your network of advisors or mentees and to seek advice from others. It's okay to look for opportunities to collaborate with someone outside of your mentorship circle or your collaborative circle, or outside of your lab or outside of your research project. It's okay to even think about, and I'm not just encouraging anyone to leave where they are at the institution, but particularly for staff and faculty, this is one of the challenges, and I'll speak very candidly for faculty and staff who are from racial, ethnic, minority backgrounds. Oftentimes, and I'm not just speaking, tongue in cheek, this is robust literature here and evidence behind this, but they're often undervalued. And so, it's okay to look elsewhere and to find a place where you feel like you will be valued and you can execute on the work that you're most passionate about doing amongst colleagues in an environment that will be inclusive of you.
Great advice. I know that you do so much you wear many hats, but so much with community engagement. I would venture to say one of your hats as well is being a science communicator. You have your own YouTube channel. You do so much with communicating with the public. What are some things that you've done to enhance your communication skills? And
Oh, that
be
is so good.
approachable?
That is so good. So so a couple of things. One is practice, practice, practice. So any opportunity that you can get to practice your communication across different audiences, whether they be lay people from differing education backgrounds, whether it be people from different cultures, whether it be audiences, different types, different levels of academia, practice, leverage those opportunities to present an abstract, to speak at a conference and give an oral presentation. And if you do that, also, practice those things. Speak in the mirror, speak to your spouse or friend or colleague, practice those things over and over and over again. And that's how you become proficient at it. I think too, I had the benefit. I'll give you two concrete examples and how my wife and I have differed in our approach from with communication. One is I was fortunate that in undergraduate I took a public speaking course. So I sought an opportunity to become better at public speaking while I was doing my coursework. My wife, on the other hand, she has done this more recently in the past, 5 or so years. She did something called Toastmasters, and you may have a Toastmasters there where you're located. Sometimes these are in the community and not affiliated necessarily with your institution, but you can Google Toastmasters and find one that's close to you. But these are communities of people that come together to learn how to be better public speakers. So Toastmasters is a great way to become a better communicator. But it's not just about oral communication. You have to also be good at your written communication. And that too comes with practice, with, writing grants, writing papers, writing emails, and I'll pause for a second on the email piece because I highly encourage everyone, we're living in a virtual space. There's more emails being sent now than ever. Never send an email that you would not mind being broadcast on a billboard. Never send an email that you wouldn't mind being broadcast on a billboard. Emails are receipts. So, just be mindful. This is brand protection here. Be mindful of what you send in emails and just practice how you communicate in written a language as well. And lastly, I'll say, and this goes to your earlier point about YouTube, this is a time to start building brand on social media. No matter what level of career you're at, there is opportunity because social media is allowing us to disseminate science, knowledge, and information faster than ever, faster than your paper will get there and get to people's hands via a journal. It can get there via social media, leveraging Twitter or Instagram or any of these other YouTube. So think about how you can leverage social media to advance your career, to disseminate your science, but also to connect to a community of potential mentors and sponsors too.
Thank you. Yeah, and if anyone has not checked out Dr. Gray's YouTube channel, I highly suggest that you can go see some of the things that are posted there as well. Are there any other questions or thoughts? There's another one. You also emphasize the impact of connecting with the community and amplifying their voice. In your field, you have face-to-face contact with a lot of these community members daily. How do you suggest that connection being reinforced in science where face-to-face contact might be lacking?
Oh, these are all great questions. Thank you for all of them. So one opportunity, and I'm not sure about what resources you have there, but many institutions have a CTSA, or basically we at Ohio State, we call it CCTS, which is part of our CTSA. That stands for Center for Clinical and Translational Sciences. Within that center, we have, not only do we have a community advisory board, but we also have a community scientist program. Now, why is that important and how does it relate to that question? Well, For those of you who are in science fields where you lack in-person or community contact, it's so important to run your ideas or be able to speak to community members, whether it be through a community advisory board or a community scientist program. So I suspect that in some part of your institution, there is a community advisory board, and leverage opportunities to try to get in front of them. Even if it's just to present your idea, maybe you present some completed work that you've done, but to interact with the community and get their input on how it translates to their daily lives. So leveraging for me and for some scientists that I interact with, that has been very valuable, leveraging community advisory board, particularly for those who don't have a lot of community contact. Or let's say I gave the example of Alzheimer's disease and those working that, reach out to an advocacy organization that may be tied to your science in some way, whatever you're doing. There's likely to be some advocacy organization that is supporting or can support some of the work that you do. So reach out to them to see if you're able to present to that group and get feedback. But that's what I would recommend.
Well, thank you so much. I know you have another, we're going to parlay this into another talk as well. I know some people will be leaving and some people will be joining, but I thought maybe everyone could use a little bit of a break before you start your next hour talk, Dr. Gray. So if you need to take a rest, and then Dr. Stephen Beaupart will be taking over for that section. So thank you so much. Again, it was an honor to have you and hear from you today, and we can't thank you enough.
Thank you so much. It was such an honor to be amongst you. Again, don't hesitate. You can email me, you can text me from that phone number I gave you. I don't mind. I am out of town today, so my response will likely be delayed, but thanks so much.
Thank you.